And as far as the psychotherapy training is concerned, we're very passionate about that here, and we like to think of psychotherapy, particularly when we're teaching it to the first-year residents and the second-year residents, not to get too hung up on the specific modalities right off the bat, your CBTs, your interpersonal therapies, your psychodynamic therapies, your DBTs, whatever they may be, but really trying to point at, what are the essential elements of psychotherapy that really bring all of those things together. And there's research in the university here, particularly in the psychology department, around common factors of psychotherapy, and that there are some really core essential ways of relating to people and creating a safe psychological space that have an awful lot more to do with outcome and the effectiveness of psychotherapy than really getting hung up on the specific treatment modalities. Now, there are certainly circumstances under which you'll want a more specific treatment modality, but I think for the purposes of training psychiatrists, especially early on, really trying to get people fluent and skillful in the basic elements of a psychotherapeutic encounter it is really, really important. So that's something that we introduce in the first year. Really before people are even having to do psychotherapy, when they're still primarily on the inpatient units. So, and the whole idea is that psychotherapy, while there's a knowledge base that's important to understand, and certain concepts to help to kind of orient people as to what to do and where to focus energy, it's much more of a in-the-moment process that's really based on cultivating a set of skills of sort of relating with people. And it's actually possible to teach some of these skills. I mean, a lot of people sort of do them kind of automatically and very naturally, but we really try to point at things like paying very close attention to body language, paying very close attention to the way people respond when you ask a question, paying close attention to the way people use language and the types of metaphors they may use. And additionally, always having an ear and an eye out for when emotional processes are at play, because no matter what form of therapy, many of them converge on emotional processes playing out with people. And so we really want to get people feeling comfortable with exploring emotion and working with emotion. And it's a set of skills that isn't commonly taught anywhere in our sort of school system up to a residency. Not even in medical school is this really taught in a lot of places. So really learning how to work with emotion that helps to kind of connect people both to their exterior world and then also to their own interior world is a really important process that we want to kind of point at. And to sort of transition a little bit, the mindfulness training that we do here, I think is very supportive of being able to do that process well, because part of what mindfulness practice is about is developing concentration and the continuity of awareness really moment by moment by moment. And when you're working with somebody in therapy, you really have to be really present with the person in the moment and be responding as things are coming about. And a lot of people, when they're interacting, will have sort of a real script in their mind, or they'll ask a question and then they'll be interiorly setting up the next question and interiorly setting up the next question. Meanwhile, may not be paying a whole lot of attention to exactly how is this playing with the person. So these mindfulness practices, I think, really help to bring people back into kind of the present moment, which is where this psychotherapeutic process happens. One of the other things to appreciate about kind of the psychotherapeutic training here and just the particularly the kind of psychodynamic tradition that we have here at the UW. It's a very interesting tradition, and something that we really have been trying to kind of foster and cultivate. And so, our kind of psychodynamic approach here isn't a classic psychoanalytic approach where you throw somebody on the couch for an hour 5 times a week and set up free association and just let them run, and that's not how we kind of view psychodynamics here. It's really about sort of understanding an individual, not just sort of the person in front of you and the cluster of symptoms that they're presenting with, but really understanding like the whole person and understanding how they got to be the individual that they are and where they're headed in the world. Because there are so many people who are struggling with depression, and that the depression, is something that we treat given with evidence-based practices and medications and psychotherapies, but that there are also people who are lost in terms of where are they trying to go to, and that oftentimes you can get a sense of sort of how people are trying to project themselves into the world and play themselves into the world based on the set of experiences and conditioning forces that have been at play from the point that the person was even born, through childhood, through adolescence, through young adulthood, out into the whole lifespan. And so part of our approach here is about trying to get a real comprehensive picture of who is this person, and what path are they on, and what are the obstacles that are arising on that path. So, and one of the other things that's sort of cool about this place is that we often like to look at dreams as a way of getting at and sort of understanding a past history, because the images in dreams will often be composed of situations, settings, people, feelings that have occurred in the past at some point. And so it's possible by looking at dreams to be able to kind of to pull apart what's the content of this and make an inquiry into, okay, well, what experiences have you had that maybe connect to this dream? And then also, what does this image tell you about how to move prospectively into the world? And because that's a super important part of the dynamic tradition here, is that we don't want to be exclusively retrospective in the way that we look at a patient's history, because I think doing a deep dive into the situations and the difficulties that have arisen and the patterns of relating that play out is most useful when it can be related to, and how would you like to move forward into the world? What would you like to do differently? How would you like to choose to act, sort of given these conditions? Just as a plug for something that we do here that I think is truly unique in residency programs, is that we have a dream group that meets every other week, and that's something that's led by myself and Dr. Gustafson and Dr. Moore, and there are a number of psychologists and staff members and residents who have been involved with this group, and it's really been just a beautiful setting in which to explore our own dreams and what they point to, and often have really cool insights about what's going on in the clinic, what's going on with our patients, what's going on in our lives, that I think can be really illuminating and a really interesting way of developing sort of more self-awareness and more understanding of where do I come from. So that's something that if that piques anybody's interest, this would be the place to come. These practices are something that are important also from the standpoint of helping people to have kind of a structured way to to experience their own kind of emotional states and their own thinking processes. Because anybody who's applying for a psychiatry residency is aware of ideas like transference and countertransference, which has to do with how people are sort of automatically responding to each other, either the patient to the doctor or the doctor to the patient. And so part of what these practices can allow people to do is to really get clear about when they're having some emotional process get triggered for them in the middle of a patient interaction. And I personally think that it's really important to be sort of learning that process, because without having a clear awareness moment by moment as that's happening in a patient encounter, people will be blown about by their own emotional reactions with the patient in the room, and oftentimes those automatic reactions aren't necessarily helpful to the patient and the difficulty that they're experiencing. So again, it's something that I think helps us to know really what's going on interiorly with us, and then allows for one to be a little more intentional in the way that one interacts with patients. And that's kind of how the mindfulness piece relates to the psychotherapy end of things. I think the other end is about, that these skills really can be supportive of, knowing where one is in one's own process. And with the forces at play in the modern medical system, with really trying to address an enormous need in terms of psychiatric treatment, in a system that tends to be running faster and faster and faster and faster, and adding on more and more and more layers of paperwork and duties, that to really be able to kind of step back and notice, well, when am I getting flooded with these things? When do I need to take a break? Do something to nourish and support my own well-being, or when do I have a little bit more energy in my tank in order to, reach out and be altruistic to, say, a colleague who's struggling, or when can I, really put forth energy, and then when do I need to kind of look for social connection in a way that's supportive. So again, I think part of these practices is about just really being honest and clear with oneself about how am I doing in this process, and then getting clear also about, well, what would be a skillful thing to do to kind of help myself, and then also to make me more available and present to deliver compassionate and empathic care to patients, which is really what it's all about.